Our next speaker is Chef Lauren Posa. Lauren is a chef and restaurant manager at the Farmacy restaurant on Mason Street in Green Bay. Lauren has been passionate about the joy of nourishing, lean, and delicious food can bring to the people around her. Her study of food has been diverse and hands-on, starting with an associate's degree in sustainable cuisine from Colorado Mountain College. From there, Lauren fell in love with the agriculture of food. As a manager of permaculture farm in Oahu, Lauren started a CSA and brought schools onto the farm to further share the love of the nourishing food that grew there with her community. Lauren moved back to the mainland where she became a chef at a resort. Soon after, she started her own business as a private chef with a long list of loyal clients. In the face of health changes, Lauren enrolled in the Wellness Ways Academy to learn how to restore her health and support others in their wellness journey. She combined her new education with providing simple, nourishing food as a way to encourage others through meal prep and as a private chef. The next logical step was a quick-serve restaurant to broaden her reach, and the Farmacy was born. Today, Lauren will share her personal story and discuss the importance of inflammation-reducing diet for neurological disorders. Please give a warm welcome to Chef Lauren Posa.
Thank you so much for having me here today. My name is Lauren. I am the chef and owner of the Farmacy Restorative Eatery. I am going to share my story today because there's a much bigger reason why I'm here today other than sharing food. This healthy food is very personal to me as to why I have to eat this way. I'm from Michigan, and good, maybe some other Michigan people. I went to Colorado Mountain College in Vail, Colorado for sustainable cuisine. It was farm-to-table culinary arts. Originally, I was going to go to school for dietetics, but I knew that I didn't want to work in a clinic setting. So I ended up moving to Colorado, and I fell in love with agriculture. When I went to culinary school, I'd never actually held a knife before. I didn't know how to cook anything. I grew up in Upper Michigan, so all I ate and learned how to cook was hamburger and potatoes and canned green beans. That was my whole diet. I also was a big fan of those packaged ramen noodles growing up. That was like my favorite thing. And anything that involved sugar. All right, so after I went to school in Vail, Colorado, I ended up moving to Hawaii. My brother and sister were actually raised in Hawaii, so I thought that it would be cool to be able to go and experience Hawaii. I went and ran a small permaculture farm for 6 months. I lived in a tent, not like a hut, like one of those little 4-person camping tents that I had to crawl in and out of. And every morning I was greeted by the pigs and the chickens because they were ready to eat. I showered with a hose that was located in the center of the farm with a little tiny pavilion, so I really lived the life. I got to eat from the farm every single day, and I got to enjoy all the beauty of Hawaii. After 6 months of living in a tent, you can imagine I was ready for something else. So I ended up moving to Traverse City, Michigan, where I worked in a couple different restaurants. At that time, I decided I would never work in a restaurant again. That was not the life for me. Fast forward a little bit, I moved back to Hawaii for a program called YWAM, which is Youth with a Mission. And while I was in this program, I was on the Big Island of Hawaii. I never actually made it overseas. When I was in Hawaii, I was 21 at the time. I was determined that I was going to live overseas for the rest of my life. So Papua New Guinea was my destination location. I wanted to live there for the rest of my life and do community development. But while I was on the Big Island of Hawaii, I contracted something called rat lung worm disease. Rat lung worm disease is a parasitic infection of the brain. It had affected my nervous system. It also gave me meningitis. I was hospitalized. I couldn't walk. I couldn't move. I couldn't do anything. I was heavily medicated. I was taking prednisone, gabapentin, morphine. I was getting multiple spinal taps, which left me with other nerve damage, albendazole, and more just to get through the day. I was on a straight-up morphine drip for the pain for weeks on end. Anytime I tried to leave the hospital, I had to go right back to the hospital. And again, I'm 21 years old, so this was pretty scary for me, given that I thought that I was going to not necessarily travel the world, but live overseas. And I also thought that God had given me a mission to go and become a missionary. And now I'm hospitalized, and all my plans are ruined. So it was a pretty terrible time in my life. And the support groups for this rat lungworm disease that I had, everyone that was in these support groups told me, you will never have a quality of life, you will never have a job. You will be on these medications for the rest of your life, and if you decide to try and get off these medications, you're gonna have to resort to things like heavily using THC, heavily using alcohol to numb your pain. And that's the support that I had while I was 21 and really sick. I decided that was not my future. Might have been the morphine talking, but I knew I was not going to take that as the prediction for the rest of my life. And so I ended up moving back home, and I found a company called The Wellness Way. Is anyone here familiar with The Wellness Way? I see a hand, a couple of hands. Okay, that's great. So The Wellness Way has a couple different clinics around the country. I am trained with The Wellness Way as a functional, holistic restoration coach, and their practice is called the Carpenter approach. They believe that normal medical system doctors, very necessary. They are like firemen. When a house is on fire, who do you call? The firemen. They do the best job. They put out the fire, they help the house so that everyone can get out safely. Firemen are very important. But after this house is on fire, and the fireman comes and douses it in water and all the things that they do, you're probably not going to be able to live in this house anymore. So now you might have to call the carpenter. The carpenter is going to come and he is going to repair the house so that you can live in it again. And the Wellness Way goes about the medical system like that. So I needed prednisone, gabapentin, morphine. I needed all these different medications to bring the fire down in my body. After taking those medications, my body was a mess. I was depressed. I had severe anxiety. My gut was a mess. I could have been here speaking today and not remembered it that night. That's how bad everything was. My nerve pain was uncontrollable. I had to take nerve controllers. So the Wellness Way came in, and they were the carpenters of my body, and they helped repair what had happened from the sickness and from all the medication. And I'm very thankful for that. So what they did is they helped to reduce the inflammation. While I don't have Parkinson's, and it's somewhat new to me to be learning about Parkinson's, I find this relatable because every single person, especially in America, has inflammation in some way or another. You might have brain fog. You might have arthritis. You might have cancer. You might have diabetes. You might have thyroid issues. Whatever it is, you have some kind of inflammation due to the foods that we're eating. I'm very thankful for all the food that people make, but ultimately, starting your day with a donut is not the best thing to do. So I just want to be able to help encourage you guys today in taking a few changes to live a better lifestyle. After I got sick and I was on the road to recovery and I realized that all these changes that I was making was working, I knew that I had to go a step further, and I can be quite obsessive about things, so I just decided to make it my whole personality, and I opened a restaurant. There's a few things that happen in between, but some of the things that I do in my daily life is in the top corner, food is my number one trigger for not feeling well. To this day, I was 21 when I got sick. I'm 28 today. And 7 years later, I'm not healed. Every single day, I have to make a conscious effort to take care of myself. One sip of wine, my nerve pain goes crazy. One bite of gluten, my nerve pain goes crazy. One bite of sugar, I have brain fog. Eating any of my food sensitivities, I might be out for a couple days. I was up here this morning, I brought my grass-fed, nitrate-free beef jerky for breakfast. I had a flaxseed dark chocolate bran muffin and a little chia packet because I came from Green Bay. I needed some treats, I needed breakfast, I needed something to power me throughout the day. And I know that anywhere I go, I have to pack my own food. And that's part of it. I'm okay with it. I bring a little cooler. I've got my cooler sitting right over there. I pack all of my own food because I want to make sure that I'm sharp and that I'm able to share my story with everyone. A big part of being able to keep up on eating healthy, I'm sure anyone here, no matter where you're at in your diet, even if you think that you eat healthy, I can assume that you also struggle with not eating perfectly clean all the time because it's really hard. But if you know why you're eating clean, that really helps you to be able to get through the day. So I know every day my purpose is I do need to be a good role model for everyone else, but your reason for eating healthy might be you want to be able to hang out with your kids, your grandkids, your spouse, your friends. You want to be able to be there for them longer. You want to be able to go and walk the mall. You want to be able to go out and go to the park with your grandkids. This is one of the most important things that anyone on the planet can do for themselves is eating a good diet. The other things are also very important. This is just my passion, what I'm sharing about today. So obviously exercise, spending time together, supplements for me have been a big part of it because I want to be not medicated. Even before I came up here, I took multiple supplements so I could try to calm my nerves down. I take a lot of supplements every single day still. So what came out of all of this is that I opened a restaurant called the Farmacy. And you can see how it's spelled in one of the pictures. Pharmacy does not necessarily mean farm to table. It's food is medicine. We're doing what more pharmacies could be offering is things that are going to not just put out the fire, but we want to build back up your body. So all the food that we serve is anti-inflammatory food. And we focus on no gluten. Gluten's not the enemy, but we don't have enough time to talk about why we're gluten-free today. We are mostly dairy-free, and the dairy that we do use is grass-fed, organic. Our proteins, we use grass-fed beef, organic chicken, all that. We have an in-house restaurant, so is anyone from Green Bay? Couple people. Okay, I hope to see you guys very soon. And I do know some people from Green Bay here today. We have in-house seating. We do catering, we have meal prep, and we do cooking classes. We're working on putting more out to the public so that you guys can have that virtually and for free. We are opening a second restaurant, which is going to have more space for cooking classes. So if you've ever been in this restaurant, it only has 17 seats. We're very small. We are extremely busy. If you come at lunch, there's a good chance you won't get any seats. And the biggest thing is that, again, food is medicine. Every bite we take either calms or fuels the inflammation. And many of you may have eaten whatever you ate for breakfast this morning. If it didn't give you energy, probably wasn't the right food for you to have. Some people do feel sluggish after they eat just because their bodies are not functioning properly, but food is supposed to be your fuel. It should not be making you exhausted when you're eating it. You should be feeling good from your food. So we will be getting into the recipes, and our number one thing that we're going to be working through today is just a couple anti-inflammatory recipes, foods that you might eat on a normal basis, but we just made them a little bit healthier. These are just some steps that you can do other than your diet, but cleaning up your diet, eating anti-inflammatory foods, balancing your blood sugar by eating a balanced diet, supporting gut health, sleep, and managing stress. These are all things that are going to be good to help rebuild your body. There's really a lot to it, especially if you don't already eat a clean diet. I had someone come up to me today and she asked me about olive oil. Olive oil is great for the body. You can drink the olive oil, you can put it on your food. There's Celtic sea salt, there's sugars, there's all sorts of things that I want to tell you about today. We're just gonna focus on a couple of them. And I'm actually gonna go forward to the cookies first. So in front of you, I know so many of you already ate it, and that's great. I hope that you really enjoyed it. So the thing that was on top was a chewy oat flour cookie. And if you go into your book, I don't have the actual recipe up here, but in your book you have the recipe. Have a fun little camera that you'll be able to see what I'm doing, because I know that a lot of you are further away. So we can get the camera going so we can start on this recipe. Okay, I'll make sure that you guys can see it okay. All right, and I'll put this over here as well. That's so fun. This is my first time doing something like this, so it's cool and exciting for me. All right, we're starting with oat flour. Oat flour is just ground up oats. You don't have to buy special oat flour. I just take rolled oats. If you are celiac, you have to buy gluten-free oats, but if you're not, just buy any oats. I like this brand. And I just pulse it up, and I forgot that we're in two different places. I just pulse it up and make my own oat flour. So this is more of a textured oat flour. If you buy oat flour from the store, it's going to be super pulverized. But if you're just getting into baking, I did this too. I went and bought all these different flours, all these different ingredients, and then I'm left with all these things that I'm never going to use. So I try to just use what I have on hand. And pulsing up your own oats is a lot cheaper than buying oat flour. Oat flour is kind of expensive. So we are going to go with my homemade oat flour, 1.5 cups. And I never want to wash a lot of dishes, so I'm just going to use the same measuring cup. We have 1.5 cups of oat flour. We're going to use arrowroot. If you don't have arrowroot, you can use the other replacement for arrowroot would be cornstarch. I don't use cornstarch anymore because corn has its own issues. So I go through a lot of arrowroot. And if you're trying to do things naturally at home, going all non-toxic, arrowroot mixed with cocoa powder makes a great dry shampoo. So if you need some health tips and some styling tips, you can actually put it into your hair. So I added 2 tablespoons of arrowroot powder. I'm now going to add 1/2 teaspoon of baking soda. We buy everything in like huge containers, so you can't actually see which container. And my teaspoon, 1/2 teaspoon. We're gonna go with 1/3 cup of avocado oil. This would be a replacement for vegetable oil. If you haven't gotten into learning about why you need to swap away from different vegetable oils, I would suggest starting that journey because it's quite an important journey to learn about what you're putting into your body. Typically, avocado oil I don't use in baking. I use coconut oil a lot more often. But I found that coconut oil, you have to melt it. And if you melt your coconut oil at too high of a temperature, even though it's a high temp oil, it gets a super coconutty flavor, and then it makes everything taste like coconut. So this is a neutral flavor. It's not going to taste like anything. You won't notice any difference. It'll be a little bit more expensive than vegetable oil. And I didn't bring a 1/3 cup measuring cup, so I'm just going to guesstimate a little bit. If you know me outside of this, I'm not really a recipe person, so opening a restaurant was quite hard because I have 17 employees, and none of them are professional chefs. So I have had to learn how to write really great recipes. We are going to add our maple syrup, and I'm not doing dry and then wet because for this recipe specifically, you don't need to. I'm adding 1/2 cup of maple syrup. I do get this from just a couple minutes away from the restaurant, which is nice. I'm going to add 1 egg. I should have brought a chicken egg so you can see the difference. This is a duck egg. If anyone's familiar with food allergies and different proteins and different foods, chicken eggs are one of the first foods that people are eating. They're also in a lot of products that we're consuming from a young age. And based on more of a holistic style, they recommend not feeding children normal food, just breast milk, until they're about a year old. The foods that these children are eating from an early age, peanut butter, chicken eggs, because they're soft, they end up being, and if you look it up, one of the top food allergies, because they're introduced a little bit too soon. Whereas a duck egg, the protein's a little bit different, so I actually can't eat chicken eggs. I get severe brain fog and a stomach ache from it, but I can eat duck eggs. So in our restaurant, for all of our baking, we just use duck eggs. They do have a harder shell, so once you get used to cracking a duck egg, every time now I go to crack a chicken egg, I smash it on the table and it just destroys the entire egg because they're so much thinner. I don't recommend goose eggs or turkey eggs. They don't taste very good. In baking, they are okay. So I have my egg in there, vanilla, 1 teaspoon, or a little extra. It's kind of like garlic. Vanilla is the garlic of baking, and I always add a little more. We have chocolate chips, and then the only thing that I didn't put, because it's an option, which I will never skip, but I didn't put it in there because some people are concerned about salt. I put salt in everything. This is Celtic sea salt. This is a must-have in your cupboard. Out of anything, I was just on a podcast with someone in here recently, and she asked me what's the number one thing that I need to have in a kitchen. It is this salt. This salt is medicinal. It's not just salt. This salt is filled with so many nutrients. It's not processed. And here, we'll go under this camera so you can see the texture of it. It's not refined at all. So you can see that it's really chunky. Even if you were to get this in a super fine ground, it's going to be a different texture. It's a little bit wet. It tastes delicious. I will take this as a supplement because it has so many minerals in it. And how you do that is you take a pinch of it. I had someone do that earlier today. And you put it under your tongue, and it's a supplement. You can also put it into your water because you're going to help with mineral balancing. So I have some salt in there. And our last ingredient is chocolate chips. This is my favorite brand of chocolate chips. If you can get that in a store near you, lots of places have it. Even Walmart often has it. This chocolate just has chocolate liqueur, erythritol, cocoa butter, sunflower lecithin, vanilla extract, and stevia. So there's no sugar, no dairy. And that's the most important part because it tastes like there's sugar in it. My dad is one of those people who has like a giant thing of chocolate chips all the time, and every night he goes and puts a handful, and that's what he eats for his snack. This is a good option if you're one of those chocolate people. So what we're gonna do is we're gonna just give it a good mix. The best thing that I've learned in the past year, so I was not doing that when I first opened the restaurant, with gluten-free baking, is you can see how wet this is. I will add the chocolate chips once I get this all mixed up. I'll add those, and then I'll tell you my secret for gluten-free baking. We're gonna add a half a cup of chocolate chips, or however many you want. I pulverize these chocolate chips so that the chocolate will spread a little bit further into it. You have to let the dough sit. Obviously, this is not like a normal chocolate chip cookie dough consistency. It magically just sat for an hour, and now it looks like cookie dough. So that's my biggest secret that I haven't even shared in any of my cooking videos yet, is that gluten-free baking of all sorts just needs to rest, and it's gonna make the consistency so much better. Our gluten-free pancakes, you wouldn't even know that they're gluten-free because we just make them in the right process, and the biggest thing is let the dough rest at room temperature, not in the fridge, because you have to let it give time to absorb everything. And unlike gluten-filled items, you can't really overmix it because there's no gluten in it for it to become glutinous. If you haven't already, eat your cookie, because this is the cookie dough. I will not be baking the cookies up here, but this is the finished cookie dough product. It does have eggs in it. If you're someone who loves raw cookie dough, you can always make this without the eggs, and you can eat it just like this. You can also press it into a pan, and you can just turn it into a protein ball. And it's very simple. So we're gonna move on to our next recipe. I have a very exciting, I guess, secret also that I learned. Because has anyone ever tried to find avocados ripe at the store? They're not ripe, and then you get them home, and now they're ruined. They're just totally overripe. Well, I, of course, forgot that I needed to buy my avocados for this. So I went to the store yesterday, and there was no ripe avocados. So I read online that you put your avocados in a bag with a banana, and the science process that I cannot tell you because I don't know what it is, makes for a perfectly ripe avocado. These were hard yesterday, and they are perfectly soft. I just asked God to do this. It's like turning water into wine. I just needed him to ripen my avocados. He did it, or the banana did it. Either way, we have really good avocados for today, so I'm excited about that. And all of them are perfect. It's crazy. Okay, so one of my favorite tools, salt's my favorite ingredient to have in a kitchen. My favorite utensil, kitchen gadget is a food processor. My mom was in the time of all those, what's the company that always has the parties where you go and buy all the gadgets? Pampered Chef, yes. Those parties were the best. I used to go with my mom to all the Pampered Chef events, and there was this little thing that you'd put a deviled egg and it sliced it. I didn't even eat deviled eggs, but I made my mom buy it because it was really cool. And you could get a million gadgets, and my mom was always like, you don't need gadgets. You need simple things. And now I'm all about simplicity. So my food processor, other than a knife, this is my second most used thing. I travel everywhere with this. I know that's a weird travel friend, but I love my food processor. So you can do so many things with this because it doesn't just mix things. You can cut and slice and shred, and it makes your life a lot easier because cooking can be a lot of work. So this helps to make your life a little bit better. We are going to start on our avocado mousse. I'm going to cut open my avocados. And this will not work if you don't have ripe avocados, but this is a great recipe for if you bought a bunch of avocados and all of a sudden they're all ripe on the same day. This is a good way to use them up, and then you can kind of preserve them as well. So this recipe is only for 2 avocados. I made avocado mousse for 500 people yesterday. I don't even know how many avocados that was, but that's no joke when you are trying to find ripe avocados all at the same time. So you can see that's a very nice avocado. In my adult age, these are the things that I get excited about, is a beautiful avocado. I'm going to squeeze that in and pop out my seed. You could use a spoon too, but I just do it this way. Another skincare hack is once you're done with your avocados, if you're at home, you can open up the avocado skin. I'm not gonna do it because I'm wearing a bunch of makeup. You just rub it all over your face. This has so much moisture in it. It is great for your skin. You can also take it and you can wipe it all over your hands, and it's just like lotion. It's really great for you. When I was in Hawaii, we took every fruit and vegetable and we used it for everything. Papaya has great enzymes in it. The avocado for face masks. We did things for foot masks. Your food is so much more than just your food. And if you look at the ingredients of a lot of things, skincare that you're buying from the store, it's all things that you're eating. I now only use beef tallow on my face and my whole body. That's the only moisturizer that I use. And I went to go bring it to my business partner the other day to try it on, and he took a big fingerful and he ate it. And I was like, that was lotion. You were supposed to put it on your hands. He's like, well, if you're making something that I can't eat, then I shouldn't be putting it on my skin anyways. And I was like, well, you're right. And it did have all things that he could have. It's a little weird. I would not eat the lotion, but it's clean enough that you can. All right, so I have my avocados in here. I'm going to add my maple syrup. We are doing a 1/3 cup, but you can add as much as you like. And it says coconut milk in your recipe book. I didn't put coconut milk in your avocado mousse because I just didn't want to have any of the allergy issues in there. So I'm going to show you today without the coconut milk in there. And as I'm doing this, my only concern is that I won't be making enough, but you guys will be able to get the gist of it. We're adding our vanilla. Again, measure with your heart. And sea salt. Anything chocolate I do, I also add salt on top just because it tastes really delicious. And we're going to add cacao. Cacao is different than cocoa because it's the less processed version of it. So if you want all the nutrients, like they say that chocolate's good for you, Hershey's chocolate is not good for you. But if you buy a chocolate bar that's made out of cacao in its most raw form, this is how you're going to get the most nutrients from it. And we're adding a 1/4 cup. It'll also result in a little bit of a richer taste. Okay, I have everything in here. Let's hope this works. Oh, it does. Okay, so I'm going to turn it on, and that's going to blend. You can also use a standing mixer. You could also just use a fork and mash it all up. This will just make it a little bit more whipped. So we're going to let it go for a moment. And you always want to taste it, see if you need to add anything. It's looking pretty good. It's still a little bit of chunky. So if I was serving this, then I would just keep it going. But for time's sake, we're going to leave it. And this is a good consistency for the mousse. And we'll just give it a little taste. And that's perfect. The flavor will change a little bit because the cacao will set in, the flavors will meld. So you guys, this was made yesterday, so it's a little bit deeper in flavor. So that's the whole recipe. Those are really quick. I know that I've been up here for a while, but those recipes are really easy to make at home. You can also make you would just change this up a little bit. You can do a mousse out of chickpeas. So if you're looking for maybe less fat and more fiber and protein, you can make this out of chickpeas, and it's going to be almost the exact same ingredients. Or you can add chickpeas to this to make it a higher protein snack. So if you want to have chocolate pudding for breakfast, add some chickpeas, and this is perfect. Otherwise, this is a great breakfast to have with these oat flour cookies that are low in sugar because they're just sweetened with the maple syrup and the avocado mousse. I love to find all the delicious desserts that I can have at any time of the day. So I gotta find my clicker out of all this. We can go back up to the PowerPoint. One thing that I've been trying to work on lately, my most recent goal, is to start doing things that I can thank my future self for. Eating the pizza today, my tomorrow self is not going to feel good. So I choose to not eat the pizza today. Maybe I make a homemade pizza that's with ingredients that I can have. I'm gonna choose the avocado mousse over the Nestle pudding cups or whatever brand it is. I'm gonna make the choices that are gonna make me feel better in my future because it's not just about me, it's all the people that are around me that need me to be in my top shape and my top condition. If you are interested, I know that I've said a lot today, I'm kind of scattered. I would love to share more with you. You can either follow us on social media. All of this information is in our book. Otherwise, come and visit at the restaurant. If you are not local, and this is in your book as well, I put my personal email in there. If you have questions about anything that I made today, if you need help guiding yourself into a better future for food because you want to feel better, I am happy to work with you on that. I can answer any questions for free. We don't have any paid services as of right now. I just want to help people feel better, and you can find me through all of that. So today, I just want you to take away that food is either fueling or calming your inflammation. Brain health is impacted by diet, blood sugar, gut health, stress, and sleep. Healing starts with small, intentional steps like upgrading one meal at a time or one dessert, one snack at a time. And you are not alone. Healing is possible with the right support and the right tools. And I know that you guys are getting a lot of other great tools today. So I appreciate you guys coming in, listening to me today, and for just giving me this opportunity to share my story with you.
That was fantastic. Did you guys get to try your foods then? Yep.
Yes.
And
If you have not.
yeah.
And
how
there might
did you
be
like
some
it?
at the table, so you can go and steal someone else's if you want a second one.
And those are really great tips. I absolutely love how you say, doing one thing at a time, Lauren, is like so important because, changing everything all at one time just seems way too overwhelming, and I think people jump off the wagon too soon. So thank you, Lauren. So at this time, I would like to really acknowledge our sponsors. As Kelly mentioned earlier, without the sponsors today, especially our Hope sponsors, we wouldn't be here. We wouldn't be able to put this on because it does cost a lot of money. So we are just so grateful for our Hope sponsors, and we're going to hear from them today. Network Health's vision since inception in 1982 is to create healthy and strong Wisconsin communities by providing health insurance plans to individuals, families, employers, and Medicare participants. Network Health is known for providing quality, top-notch health plan coverage and for delivering exceptional local customer service, and celebrates its fourth consecutive year earning a perfect 5-star overall rating for its Medicare Advantage PPO plans from the Centers of Medicare and Medicaid Services. Additionally, the National Committee for Quality Assurance recognizes Network Health for its commitment to excellence as the sole Medicare Advantage plan in its service area to achieve that 5-star rating, along with a notable 4.5 rating for its commercial line of business. Network Health is headquartered in Menasha and also has an office here in Brookfield. For more information, you can look at networkhealth.com. And today I'm going to welcome our speaker. Corrine Dykus-Johnson is President and CEO of Network Health, a Wisconsin corporation offering commercial and Medicare Advantage health insurance plans for employers, individuals, and families, where she dedicates herself to the organization's mission of building healthy and strong Wisconsin communities. For more than 25 years, Corrine has been a Milwaukee area healthcare executive. Prior to joining Network Health, she has held progressive leadership roles at Wheaton Franciscan Healthcare, now part of Ascension, serving as Senior Vice President of Payer, Revenue, and Physician Operations, and as a Market President responsible for 3 hospitals and physician operations in the Central Market. Sharing her time and talent with the community is Corrine's passion and purpose. Corrine is actively serving and over the past 25 years has served on boards and committees of more than 20 nonprofits, helping to raise tens of millions of dollars, all focused on improving the lives of people in the community. Corrine earned her undergraduate degree from Marquette University and is a Juris Doctor from DePaul University College of the Law. Please welcome Corrine Dykus-Johnson.
Well, good afternoon, everyone. So you are making avocado chocolate mousse. By the way, I've had it. It's fabulous. I highly recommend it. Who knew that avocados could have such a great base for chocolate? And for this chocolate lover, I love it. So good afternoon. I'm so grateful to be here with you this afternoon. And as my bio said, I'm the president and CEO of Network Health. And I have the privilege and honor of leading an amazing team who work hard every day to provide an exceptional experience for all of our members. Our mission is to build healthy and strong communities, and we empower our members every day to live their life to the fullest. But that's just one aspect of our mission. We are locally owned. We're owned by Freighted Healthcare System, and we've been providing health insurance services for over 40 years. As was said, we are the only Medicare Advantage plan in the United States that can boast a 5-star rating from the Centers of Medicare and Medicaid and 5-star rating from the National Committee of Quality Assurance. And all of our employees live and work in the communities that we serve. But one of the most important things that we do as a health plan is that we support and empower our members in their care journey. It's a privilege to be a trusted partner of our members to help them find the strength and their purpose and a way forward. I'd like to share with you a brief story of one of our members who's had a difficult time with his diagnosis of Parkinson's and how he found his way forward. In 2022, a 40-year-old man who I'll call John was experiencing extreme difficulty. He had reached out to our care management team. He'd been living with Parkinson's disease and also going through a divorce. His symptoms were getting the best of him. The stresses of life were overwhelming. He reached out to the case manager that was assigned to him because he wanted to learn more about assisted suicide. John felt he couldn't continue anymore. Everything was piling up. He felt it was just too much for him. He wanted to live a normal life. He wanted to be a 40-year-old. He was struggling. He'd been experiencing so many symptoms that he felt that his only solution was ending his life. He didn't feel like he could talk about this with his family. So his case manager was the person that he looked to for a sympathetic ear and for guidance. She listened without judgment, gave him a safe place to talk and explore his options. He realized he was not alone, and he could trust their discussions to be honest and direct. She worked closely with him, providing him with resources for depression and to manage critical crisis situations. And through the years, she provided additional guidance, resources, and support that empowered him to continue living and going forward. She also reached out to his providers because he was having issues with his medications. They talked about his finances. She worked with local agencies to find an appropriate living situation for him, and she helped him find ways to manage and support him through balance and falls prevention. She gave him room to consider what was right for him and gave him a trusted space to have an honest conversation. They developed a personal and trusting relationship. And John, with the help of his case manager, discovered what was possible instead of focusing on what was impossible. John still keeps in touch with his case manager, and when she doesn't hear from him, she reaches out to let him know that she's still there for him. I'm happy to share with you that John has come a long way since his first conversation with her. He found his inner strength and the power to change his outlook on life. He now travels outside of the state of Wisconsin and enjoys life. He's currently exploring retirement locations, and yes, his case manager has been supporting him every way through his journey. John is one of many members who have benefited from the relationship of a case manager. Case managers are very special people and critical to the healthcare team. Case management is a service that is a benefit that is offered by your health insurance plan. But there are many people who don't know about this benefit, and it's an important one. So I'd like to highlight a few aspects of this valuable service. Case managers are registered nurses and social workers that are employed by health insurance companies. They're amazing people who can help you understand your diagnosis, your care plan. They can advocate for your care that you deserve, and they help you utilize all of the benefits that you have entitled to you. They're skilled individuals with focus on achievement of functional and wellness goals. They empower their clients through compassion and understanding as they navigate the healthcare journey together. Case management can be a game changer, like it was for John. When you first receive a diagnosis, confusion and fear can permeate your mind. A case manager can help you understand your diagnosis, your treatment plan, and all the resources that are available to you. Assistance with understanding what you need to do, the why behind why you need to do it, and how to maximize your treatment plan. These are all essential elements of empowerment. These case managers are subject matter experts on community resources, your insurance benefits, and all of this is invaluable in your journey. Because of their expertise, they can also be excellent advocates for you. They can get you the care that you need and make sure that you're getting that under your benefits. They do all of this work through advocacy, education, care navigation, and most importantly, by building trusting and reliable relationships. Again, this is an important benefit that you have under your insurance plan. At Network Health, we know that offering support and programs like this can have a meaningful impact on the lives of those affected by Parkinson's disease and the challenges that disease can present. We empower individuals to navigate their Parkinson's journey with confidence. With over 10 million people worldwide who are affected by movement and physical limitations, we're all here to show our commitment to this community. But acquiring knowledge about the resources available to you is an important part of that journey, and together we can promote empowered living. So, do you have a relationship with your case manager? Have you been contacted by your case manager and your health plan? If not, reach out to them. This valuable service is important, and it's a benefit that you deserve. Thank you.
Thank you so much, Corrine. Our second $10,000 sponsor is Supernus Pharmaceuticals. And today we have Emily Wilikowski, who is our Senior Sales Representative, Parkinson's Division from Supernus Pharmaceuticals. Please welcome Emily Wilikowski.
All right. Hi, guys. My name is Emily, and I've been working for Supernus Pharmaceuticals for almost 4 years now in their Parkinson's division. And the two medications that I currently sell are GoCovery and Anapgo. GoCovery is a medication that you can take before bedtime, and it's going to help with levodopa-induced dyskinesia, as well as off episodes. So if you would like to learn more about that, please stop by. But then more importantly and more exciting news is we just launched Anapgo, which is a device that patients can wear all day, and it's going to help with motor fluctuations. So it's a continuous infusion device that you attach to your waist, and it'll help with off time as well as improve good on time for you. So it's a really neat medication. It's been out in Europe for 30 years now. So it's about time that the US finally got it. I do have a device on me at my booth so I can show you how that works. And then Rex is there too, and he's been diagnosed with Parkinson's for 9 years now. He's currently on one of our medications, so we can kind of talk to you more about that and his experience on our meds. Just want to thank you for your time.